mynews.studio.
A child takes her first breath in a remote village. Today, her chances of surviving past age 5 are higher than ever before. What's driving this change?
It's November 13th, 2025. The global under-5 mortality rate is at its lowest, down 51% since 2000, according to the United Nations. So, how did we reach this point, and what does it mean for families experiencing it firsthand?
Let's look at the figures. Countries like Cambodia, Malawi, Mongolia, and Rwanda have cut child mortality by more than 75%. That's not a minor shift. It means millions of children surviving each year.
So what's changed? A significant factor is the work of community health workers. They go door to door, especially in remote places, bringing vaccines, diagnosing illnesses like pneumonia or malaria, and supporting nutrition and breastfeeding. Why is that so effective?
It comes down to trust. If you live far from a clinic but know the health worker who visits, you're more likely to follow their advice, have your child vaccinated, or seek help early. That personal connection makes a real difference.
And there's the broader system at play. The most successful programs integrate these workers into the primary health system, making sure they're trained, paid, and have the supplies they need. It's not just about volunteers showing up now and then.
The research backs this up. When countries scale up these community-based approaches, millions more lives could be saved, especially in places at highest risk. But if that's the case, why isn't this success universal?
There are major obstacles. Climate change, ongoing conflicts, and economic instability are making things tougher. For example, more extreme weather leads to more disease and food shortages. Conflict damages health infrastructure and economics.
Right, and when governments or families can't pay for healthcare, the whole system feels the strain. So while there's progress, it's also quite fragile.
Exactly. In regions like sub-Saharan Africa and Southern Asia, the response has been to strengthen health systems and invest in local health networks. Still, without steady international support, these efforts might not be enough.
The big target is clear. By 2030, we want to see the under 5 mortality rate fall to 25 per 1,000 live births. What's needed to make that happen?
More investment. That means funding health worker training and retention, expanding access to vaccines and medicines, and building better data systems. But also, narrowing the gap so the most vulnerable get resources first.
If progress slows, projections show that 35 to 48 million children could die before age 5 between now and 2030, mainly in sub-Saharan Africa and Southern Asia. That's a sobering reminder of what's at stake.
Still, the overall trend is encouraging. When child mortality drops, it strengthens families, communities, and even economies. Do you think these lessons could be used to tackle other global health issues?
That's the idea. If international collaboration and evidence-based strategies work here, they might work elsewhere too, especially when communities are at the center.
We've seen what can happen when communities, governments, and global organizations join forces. The ongoing challenge is to keep adapting, respond to new threats, and ensure every child has a fair chance.
That's our overview of the world's progress in child survival and what's left to do.
Thanks for joining us. We covered the record low in global under 5 mortality, the work of community health workers, and the risks that could set back this progress.
Thank you for listening. This episode is brought to you by mynews.studio. You can try it now for free.